What is the minimum age for breast enhancement surgery? I've partly answered that question previously as well. Anyone below the age of 18, we will not take up for breast enhancement surgery. It is mandatory that you should be at least 18 for such a surgery, unless there is a very important reason for this. I had a patient who whose mother called me up saying that she is 17 and a half and is getting modeling assignments, but her photographer has asked her to get a breast implant done because she is relatively flat for the kind of assignments that she's looking for. Possibly in such a scenario, our team will opt to do a breast enhancement surgery. Of course, there are some legalities involved, like notary uh, paperwork, along with affidavits that tell that the patient is actually asking for a breast enhancement, even though the doctor has suggested to wait till the age of 80. So many of you read breast implants need to be changed every 8 years or 5 years or 10 years. So, do you really need to change a breast implant after some time? The answer is no. You do not need to change a breast implant, which actually is a great thing because a breast implant, once it is put in your body, actually stays forever. So, all the major brands which are US FDA or CE marked give you lifetime warranty. They issue you a warranty card, and each of their websites mention that breast implants actually have a lifetime warranty. However, in the European Union, they are mandated by law to write that you are advised to change the breast implant after 10 years. It is not mandatory, it is an advisory, which is basically a legal requirement in the European Union. And therefore, all brand implant manufacturers write this as a legal requirement. However, there have been patients who have had implants in for more than 30 years as well. They're facing absolutely no problem. In fact, we have patient who did her breast implant surgery almost 17 years back, and she's absolutely perfect with no need to change the implant because the breast is soft, it is as it should have been, and therefore we believe that there is absolutely no need to change the implant after 5, 8, or 10 years.